shoulders of the legends of the past whose legacies give each of us a voice, News 19 is proud to continue our series, A Seat at the Table, which we hope is a nod to our future. The reports are meant to amplify the voices of Black people affecting change in our community today. Each has persisted in their chosen field to create a space for themselves and help others.
For Dr. Tisha Felder, that help came in the way of making sure mothers and babies in the Midlands are healthier. Starting with something that is so natural and so simple, but not at all easy. Research shows that breastfeeding improves the health of moms and babies. But those same studies also show that African American women are not nursing for a number of reasons. But there is help through Dr. Felder and the organization she helped co-found, Mochas Mamas Milk. This is A Seat at the Table. Why don't Black mothers breastfeed?
So there's a lot of reasons for that. Historically, Black women were, when you go back even to slavery, Black women, we were not able to necessarily raise and nurture our children the way that we wanted to. And in addition to that, we were often used as wet nurses to breastfeed the infants of slave masters. While I don't believe, we actually sit down and have conversations with our families and say, hey, the reason we don't breastfeed is because of, I think what really happens is we pass down those behaviors. And so when you look over time, breastfeeding became kind of it wasn't really the norm. It was like really cool to use formula for a period of time, when it emerged. And so many women stopped breastfeeding. And so then it morphed into something that people say only poor people breastfeed, because if you could afford formula, that's what you chose. But at the same time, there were some very strategic kind of marketing campaigns that really targeted Black families with formula. We did a small survey of Black mothers. We were asking them about their plans for breastfeeding, and one of the options they could choose if they chose formula, we asked them, why, reasons why they chose it. And one of the options was, I have a preference for formula. And we had a number of mothers choose that. And so I think that that's fascinating, because I think it also shows, again, the kind of those subtle ways that preferences evolve, and you don't even really know where they're coming from. To choose to breastfeed is not a lifestyle choice, and it shouldn't be seen that way. And I think from a policy standpoint, we can do more to make sure, especially for moms that work outside the home, that they have the support that they need to be able to continue breastfeeding, even when they have to go back to work.
We're going to have our entire story with Dr. Felder tonight when you join us for News 19 at 11. If you're a mom who is thinking about breastfeeding, it is a story you don't want to miss.